Well, welcome to the King County Recovery Conversations podcast. My name is Carolyn, and I'm your host today. I am here with my friend, Nichole Alexander, who I'm super excited to talk to you today. And so, hi, Nikki. Glad that you're here.
Thank you for having me. Super excited.
Yeah. So why don't we just start with some opener stuff. You and I have known each other. Oh God, I guess it's been 10 years. Yeah. And we met at the People's Place. But why don't you give us just a little overview of who you are, what you do in the world, and then we can we'll start the conversation there.
Okay. My name is Nichole Alexander. During the day, I am the director of special initiatives and outreach with the co-lead program. So underneath Purpose, Dignity, Action, that means that I work out in homeless encampments. I bring folks inside. I work to build relationships with folks that are currently unsheltered. And when we have the resources, we navigate to bring all of our folks inside and continue their journey into becoming housed, legal interactions, and so forth.
Yeah. What got you started in that line of work?
I actually was comparing jobs with somebody else. I, at the time, was going back into the prison with a program where we were teaching women business and marketing.
Yes.
And
as a woman who was formerly incarcerated.
As a woman, I was a graduate from that program. And then when I got out on an ankle monitor, I wasn't allowed to work at the time. So I was interning with the program and helping women build their business plans for their marketing jobs, their business and marketing classes. And then, but it was very small amount of time that I was doing that. And so I was comparing jobs with somebody else, and she was explaining to me what outreach was. And I immediately went to the website of where she was working and applied and was like, this is the best thing in the world.
She was working for PDA?
She was working for Reach.
Oh, okay, gotcha.
So I started out in the field in Reach, yeah.
Yeah, that's, I think that you segued us into taking it back a little farther. So you were on an ankle monitor.
I was.
Say more about what that process was like,
Yeah.
The gap between prison and home and how you found yourself, what program that was.
Yeah, so I came home on a program called the Community Parenting Alternative. I was originally, and I'll just preface this with saying, this was not my first time in prison, nor was it my second time. This was actually my third tour in prison. And this tour I did completely different than my other tours. I did go to the gym, a little pinochle, but this time I really focused on changing the outcomes of where I would be in life.
What was it like the first couple times you were down? What was the difference between the first two times and the last time?
Yeah. So the first time I went to prison, I maxed out my first time. Basically, I had been approved to graduate King County Drug Court and then was arrested that day for distribution.
Oh, yeah.
And so...
so nothing about the lifestyle changed?
Nothing about that lifestyle had changed, and I was just clean and sober doing the motions for what was required. Mm-hmm. I had completed drug court. I had completed King County Drug Court 7 years before that. And then went immediately back into the lifestyle. As a single mom, I was... continually leading a double life of working and then supplementing my income with illegal activity.
Yeah.
And so when I went to prison the first time, I thought of it as an occupational hazard.
Sure.
And sat on the card table and went to the gym.
Yep.
And I got out and I was directly back into the lifestyle within the day I left work release.
Gotcha.
And then the second time, I only made it out a year and a half. Occupational hazard, went back and same thing. And my paperwork says I was out 3 weeks and I was already under investigation by the DEA.
Yeah.
It is a known thing. I knew that was going to be my last run. I knew it when I was out. And when I got arrested, I had already been out on bail. I was a big thing. I knew I was going to go back to prison. I was Washington's Most Wanted, the whole thing, yeah. Right? And so when I was in prison, probably pretty early into my stay, my mom passed away.
Yeah.
And I had written to the therapeutic community head counselor there and said, hey, if my mom, because at the time she was still terminal, if my mom passes away for some unforeseen reason, I think I should probably come to TC. I know I have a lot of time left on my sentence, but I don't think that I'll be able to change my life if I don't put myself into this situation. And so unfortunately my mom did pass away.
Sorry.
Yeah. And it was earth-shattering to me. She was my sole support in life. And she had my children, who at this point had grown up in the system of me being in the system. Right. And so I lost myself, and this, you were there with me, but it was hard.
Yeah.
And so I did everything different, and I did everything that people suggested. At that time, I had one person on the outside that I was talking to.
Who had your kids after your mom passed?
My sister. So my mom had moved in with my sister when she was about to get on the lung transplant list. Okay. And because she was not able... She was literally at Boeing working every single day. She'd been there for over 30 years, up until a month before she passed away, and she took early retirement. So she moved in with my sister. My kids were there. And then when my mom passed away, which was very sudden, it was the day that she was put on the transplant list that night. She went unconscious. And so we donated her organs and stuff because that's what we were waiting for. And so... so my sister had my kids, and I had one person that I did not know from the game, that I did not know from the lifestyle, who I was talking to outside, via our JPay apps, right? And on phone calls. And I just started to put one foot in front of the other. And for me, which was really big, I was crying, visibly crying. Right. And I had never cried like that before. I had never felt so lost. I ended up going to TC the day that after I came back from my mom's funeral.
And tell us, for people who might not know what TC is.
TC is the therapeutic community. So it's that behavioral health and it's the behavioral health and SUD, so substance use disorder modification. So
kind of a focus on recovery.
Yeah, it's a focus on recovery and behavioral health, mental health, which... For most of us, almost all of us, that is we need to have that full care, right? The full circle of care. And so I went over there and I cried for 4 months straight. I would just talk to you and tears would be running down my face. And then DOC came and gave me more time because they realized I had been selling drugs when I was on DOC. And so they came and added more time to my sentence.
So what was the total amount of time that you had to do this last time?
I was at 89 months at that point. And I'm the longest standing TC member. I did 3 years.
Get an award for that. Congratulations, Nikki. We just thank your friends and family.
But I needed it, you know.
I do.
Something that I had asked in my letter was I just want it. Make me want real life, right? Because there's so much that was ingrained in me. I grew up in the lifestyle. I grew up very... Jekyll and Hyde. My father was fully immersed in the lifestyle, and I grew up with that. And my mother was corporate. My grandfather was an elected official, and all these things, right? And so it was very Jekyll and Hyde. And so I just wanted to want real life and in recovery. Yeah. Right.
Well, it sounds like you had whispers of it even prior to, the passing of your mom, as having some kind of internal thing that says, hey, I might need help.
Yeah. And I have been to treatment. I started going to treatment at 16 when I caught some of my first cases and would have sporadic times of sobriety. For me, it was a matter of finally just letting go. Right. And it wasn't easy. So I did my time at Mission Creek Correction Center. And I got into the butterfly program, which we're for folks that don't know, in prison, we were rearing, researching, and breeding an endangered species of butterfly called the Taylor checker spot butterfly. And it was probably in that lab that I grew just as much as I did in TC. And it was because they treat you as a human and they like educate you at the same time that you're out there. And so I had a dual focus of when I was there, right? I was like in education and I was also like healing my soul. So I was doing that, and about 18 months before my release was coming up, I applied for the community parenting alternative. You submit all this paperwork and all these letters, and they have to interview your like people that have your kids and all that kind of stuff to make sure that it's appropriate for you to go home to your kids, and that
you have family support.
That you have family support, which I couldn't go home to my sister's house. It was over full of kids and her life and her husband, and also everybody in my life thought I was coming out to sell drugs because I mean, this is the third time, right? Like,
right.
yeah.
What's
like,
different?
Yeah. And so I ended up going to a clean and sober house. I came home on an ankle bracelet, clean and sober house. And it was a women's house that was very, very new. So I had like 4 years, almost 5 years, I think, of recovery when I got out. There was women that were very fresh into their recovery and who are doing amazing to this day. I still talk to a couple of the ladies. I just saw some. I was there for almost a year before I ended up moving into my apartment and kind of like slowly reintegrating back into society.
So how long were you on the FOSA program?
11 months.
11 months.
Yeah, 11 months on CPA. And then I had some time on DOC, state DOC, which I never violated. So I think that's a big deal, right?
It's a big
Coming
deal.
from somebody who, like, when DOC came to say, like
hey, you're violating while you're in a program.
Like, you were selling drugs while you were on DOC. And I was like, wait a minute, I was on DOC. Like, I wasn't really participating. So
right. I didn't feel like I was on DOC. Right.
That's weird. Okay. Yeah. So no violations. And I was very active still. Like, while I was in prison, I had helped design a reading program for kids and their moms so that moms could stay more connected to their children
from the institution.
From prison. Yeah. So there's like a Read to Me Mommy program where you can like read a book and like send it out, but it's more based for like younger kids.
Yeah,
and
I did that program with my son.
Yeah. Like, remember when they used to send like the little cassette tapes and stuff?
That's what we did.
Yeah. So we were
Captain Underpants. That was my story.
How to Train Your Dragon. Yes. So we had my daughter was really struggling in school, and they're required
behaviorally, educationally,
and my family was struggling with her, right?
Okay.
And so she's like supposed to be reading so many minutes a day to strengthen her reading skills, and she just wasn't doing it. And like my mom was sick and all these things, and so they couldn't like just keep pushing, right? And so I had gone to the Read to Me Mommy guy and been like, what if I get a book for myself, like a chapter book, right? And get one for my daughter. Can I come in here and read chapter 1, skip 2, read chapter 3, skip 4, and do that on video? Now it's on DVD.
Yeah.
And make a little worksheet so she can practice her comprehension, right? And he was like, absolutely, let's figure it out. And so we ended up making the after school reading program for kids and moms. And the person that I was talking to, he bought the books for us and sent them Amazon for me and for my kid. And like it just took off, and we went from there. And I would, the books would make it back into the systems for the other moms and stuff. And that was one of my letters for CPA, was to be able to say like, look, she's still involved in her kids' life. And then I worked on some of the stuff for parent-teacher conferences. If your kid has an IEP or needs extra conferences, you can now access that as an incarcerated individual in Washington State. And so that is a very needed thing for a lot of our children
Yeah.
of incarcerated folks.
Well, one of the things that we don't talk about in our carceral system or just in, mainstream society is more than 80% of people who are housed in our correctional facilities are parents.
Yeah.
And I mean, you talked so beautifully about, the impacts is that, and it's all of the family dynamics. It's one thing to have, one of your family members incarcerated, but life is still happening on the outside. And it is, kids in school and family, trauma or death or, illness or any of the myriad of things that can be happening in someone's lives and the impacts that it has not only on the person who is incarcerated and is powerless generally to be able to have real impact, influence, or contribution in their family system from inside, but also is that our families do time with us.
Yeah. Yeah, and it was hard for my family because my mom was always the person that did my time with me. And I probably hadn't talked to my sister in 10 years.
Right.
And I called home one day and this is back when you could only call landlines, right? And my son answered the phone. He was little and he was like, the ambulance is here for grandma. And I was like, what? And then he had to hang up the phone. And for 2 weeks, nobody answered the phone because my mom was in the hospital. And then when she finally, and just being on the other end where you're like stressed because now
there's no way
you
to
have no
communicate.
answers, nothing. I had no one besides my mom. And when she finally answered the phone, I was like, I need you to give me my sister's phone number because I need to know what's going on.
Yeah.
And she did. And it turned out that like 6 months before that, she was only given 6 weeks to live. And she hadn't told me because what was that going to do on the, you know what I mean? And
so you got to do your time.
Yeah.
Yeah.
And so that's kind of like where that was. And then my sister had never done the incarceration family dynamics, right? And so I was used to getting trailers with my kids. I was used to my daughter coming to Girl Scouts. Was actively fighting for Boy Scouts at that time at Mission Creek. Field days, Christmases, like my mom was very much involved, and that all stopped.
Yeah.
Right. And it was hard to convince my sister, right, to like
that you were different and
the
importance of it all,
and just the cost too. Like a lot of people, like if you've never gone through it, like you have to take time off of work, you have to get the kids ready, you have to drive the hours it is there and the hours it is back, and also the emotional cost on somebody to come into that situation, be patted down, be restricted to a table, and see the person across from you, right?
Yeah. The impacts that it has on the
and
children
then go
when you
home, right?
out
And
of
do
an
that car ride home.
institution.
Yeah, so it's just really hard. And I was lucky. I did get her to finally come to some trailer visits to kind of like, I think trailer visits are a lot more peaceful than being in a visiting room visit, right? And you have time to kind of decompress and to bake cookies or to read to your kids or to hug your kids, you know. So I think that's where we still continue to have that family bond. And that really did work towards being able to go home on the program as well.
Yeah.
Yeah.
I mean, you are one of you're one of my sheroes just in relationship to, you know, because we were in institution together and, you know, and all of us have these, you know, kind of grand plans. Well, many of us, it's that, you know, talk about it's going to be different when I leave here. Mm-hmm. And I know when we say it, we mean it. You know, plenty of people are like, it's not going to be different. I'm going back to where I came from. There's plenty of that too. But there are, you know, there's plenty of people is that, you know, it gets quiet enough and you get farther enough away to forget some phone numbers and some faces. And, you know, it's like when you do your time, like whoever was your homies, nobody's really there with you when you're doing your time. And, you know, to think about, you know, who matters to me. And like, you know, where I've been investing my time in my life. Yeah. And if it's worth it. And so, and you have absolutely been one of those people that I've gotten to watch, you know, over the course of time. And you have done a brilliant job of not only like transforming your own life, but showing up in the lives of your family, you know, to the capacity that I've been able to see it, but also your impacts on the larger community is that like you are somebody that I watch give back to the world in such an incredible way that it makes me really honored to know you and to be your friend. So I feel like I just want to say that out loud and just kind of acknowledge it. Beautiful job.
Thank you.
Way to show up for the life. So would you say that the butterfly program was your introduction to education?
Yeah, I mean, I have a long history with some odd twists and turns in my education. I would say butterfly is what started me on my educational journey through
The passion.
Yeah. I didn't know it at the time when I was doing it. I was being exposed to a type of education that I really hadn't known. I'd known like pen and paper, old textbook, computer kind of education, which we didn't have.
Yeah,
in
learn
the
by
butterfly.
rote, memorize all this stuff.
Yeah, learn these sheet codes or whatever.
Yeah, sure.
That's not what we had. We had grad students that were coming in. We had biologists that were coming in. PBS came in at one point. We were actually leaving the prison to do presentations in the community at a biology conference because we had like broke a record that year. And so those little things, like
we meaning the women of the institution who were working in this program.
Yeah, so back then there was only a handful of us, like 5 of us, because we only had one lab at that time. We had like done a huge breeding season and broke all these records, and so we put all that data together and like we did it all by hand. So like people have Excel sheets and stuff like that, Google Sheets, whatever
Not
it is.
in prison, not at Mission Creek, you don't.
We have just 6-inch binders and a pencil, and you're like tracking every single caterpillar. We had 11,000 eggs that year. You know what I mean? Just like this huge amount of numbers. And so we were invited to go present, and of course we were escorted and all the things, but we did presentations, and then we were doing presentations in the prison, and we were writing all of this data and saving all this data and doing all this research. And so it actually became accredited. And so we were accumulating college credits while we were doing this through Evergreen State College. And when that was happening, like I had done a couple years there as well. And I was doing the Tacoma Community College business classes as well at night. And when I went right before I was leaving, one of the directors was like, "You should apply to go to school." And I was like, "Well, why? How would I get into college? Like, what are you talking about?" And she was like, "No, you should apply to go to Evergreen State." And I didn't like think anything. I was like, "Okay, bring the application." And they did. And they brought an old school paper application, and my application made it out of the prison. And you have to pay for those, I guess, like to apply for school. I didn't know that. It got paid. And I had to like hand write with a flexi pen, my admittance essay. So like my friend who like is now my partner, actually basically my husband, I had to like call him on a jail phone call and be like, "Hey, I'm applying for college. Can you send me examples of college admittance essays?" And there was just like, they were just coming through JPay and stuff.
JPay.
Yeah. And I ended up having to handwrite it, and like I submitted it. My application and the essay made it out, got paid for, and I got accepted before I ever walked out the door.
That's incredible.
I had to complete my AA degree, which you could not complete back then because of like regulations, law and regulations.
In the institution?
Yeah. In Washington State, you used to not be able to complete a degree on taxpayer money, like during, so those classes weren't offered. So there was 2 classes that I needed. Right. And so when I got out on the ankle bracelet, which you never know the date that you're leaving, so I couldn't prepare all the way for everything. I had to find a school that had classes that were close to it because the school I was going to didn't offer them in time. So I took 3 classes to make up for 2 classes. I completed my AA degree the first quarter I was out. Which was summer quarter. Fall quarter, I started at Evergreen. And then when I was like bringing all of my credits over, I was like, wow, I have a lot of credits, but these Evergreen credits, they're just like electives, right? And you max out.
Yeah.
And I was doing some pretty high functioning like science classes. So could we count these as science classes? So we actually worked for almost the whole year and a half it took me to complete my degree to finally get those classes acknowledged and accredited at a higher level of science. So now those are actually higher level transferable science credits for the ladies that decide to like go on in school. So
listen, continuing to, and therein you prove my point is that somebody who just really has gone above and beyond and used your own experience, even just the process of learning, because, you and I both both know, but that there's nothing inside of an institution that prepares you to come home.
No.
And if you don't have outside support or other advocacy, there is no one that is generally advocating for you to be able to do the kinds of things that you were able to do. And the impact has had, far-reaching outside implications and has paved the way for other people to be able to, use your experience to change their own lives.
I just I think because I work on the streets of Seattle every day, right? And we're in the heart of a fentanyl epidemic right now, right? And I wasn't selling fentanyl, but I was selling everything else before fentanyl, right?
Yeah.
Heroin and all the things, right? And I destroyed families, and I destroyed the community, and I destroyed lives and children and sons and mothers and brothers and all of the things, right? And I was a far nuisance on the community.
Right.
So in the ways that I can, I full passionately give back, right? And some of
It's the way we get to make an amends.
Yes, it is my amends. And I also think that it was the few yeses that I got and the people that saw in me, which things I did not even see in myself or know of, changed my whole trajectory and changed generational incarceration, generational crime. As of last week, both my children have graduated. My son has a very fancy UW degree as well, back going towards medical track again. And my daughter just graduated. They have not been involved in the incarceral system. And that is to spite the statistics around that, right?
Directly.
So my undergrad is in law and policy because I figured if I was that hard into the system, I should know the system on the other side, right? And so I really did focus on law and policy in my undergrad. And then my master's, which somebody suggested to me while still in school, you should go for your master's. And I was like, why would I do that? And what is that? Right? What are you talking about?
Right.
And I did. And I was accepted, and it's in public administration, public policy, nonprofit profit. Right.
Yeah.
And then when I was wrapping up that, somebody suggested that I go for my doctorate. And so I did. And it's an amazing doctorate. It's an educational doctorate, and the focus will be on higher educations in prison. But I'd step back for a minute because it was a very big price ticket. So I'm trying to figure out all of those things. But during my master's program, my capstone was very close to my heart. Speaking of giving back, DOC, however DOC operates, said that the butterfly program and other affiliated programs with them, because they are now earning educational credits while you are working, is now deemed school. And so you would have to be mandated to work and then electively add butterfly, turtles for the guys, all the things, right?
Right.
And so I took that to heart because every person should be able to have an internship. You should be able to work and learn and all of these things. It's a huge success for women to come out of that program in life and have these letters of recommendation and this network and this education. And so my capstone was to help change DOC policy, their education policy, to actually allow the butterfly program to be considered an apprenticeship. And so it is considered an apprenticeship program now so that folks can earn education and considered working at the same time. So that
Listen, Mama. Listen. I mean, nice taillights. You give us something really clear to follow. I think, in that kind of the spirit of all of that, what I imagine will be soon to be Dr. Nichole Alexander, is, what are some of the, I know you are pursuing some avenues to help, support you in your doctorate. And you just told me at the beginning of this podcast some things that you are working on. Why don't you tell us a little bit about your most current endeavor?
Yeah. I am doing something really, really, I'm going to age myself and say this. I'm doing something really, really cool right now. It's fucking rad. That's what I have to say. I am part of Road Trip Nations. I'm considered a road tripper. And what that is it's on PBS, and it is this documentary. They're like mini docs where they study, like folks will, when you're at a pivotal point in your life and you're trying to figure out career-wise what you want to do, is this where you want to be, dive more into something, learn about it. And I was invited to apply for Road Trip Nation's Higher Education in Prisons project that they're doing. And so I did, and I was selected with 2 other gentlemen who have done immense amounts of time. I'm the solo person that, you know, retreaded back into the prison system a couple times. They both are juvenile and very young adults sentenced to life sentences or very large amounts of time, and have recently gotten out. One as soon as 6 months, and then the other about 3 years out. And my hat goes off to them because I couldn't imagine doing this right now at their stage. But we actually travel in a big green RV and we travel to meet other individuals who are formerly incarcerated, who are doing like amazing things in life, right? And so we traveled to Pitzer College. We spoke with Romarilyn Ralston, who is at Pitzer and has developed the Project Rebound and the educational housing for folks that are formerly incarcerated, and
to be able to pursue their educational journeys.
Yeah, she did 23 years herself. We met with Mira Meany, who is at, I want to say Cal State, but I think that's wrong. It's a UC school, so don't hold it. Oh, UC Fullerton.
Okay.
And he's also part of Project Rebound. He's doing his doctorate studies in disabilities, folks with disabilities within the incarceral system. And then, of course, here in Seattle, I interviewed Tara Simmons, formerly incarcerated State Rep 23. And then I really went for the fences on this one. I interviewed Yvonne Harry, who is a woman iron worker who was trained in the prison system, which is also an educational
the vocational
training.
track.
Yes, so the track program to really highlight, like, there's not just one avenue for folks to become educated and come out and be successful in the community.
Yeah.
And then next week I fly out to Denver. And in Denver, we are going inside the women's prison and interviewing one of the first, he was the first incarcerated professor. And then we're doing another interview as well. And then at the end, we're wrapping it up by jumping out of an airplane.
Listen, I mean, what an excellent way to wrap this up.
Yeah.
Nichole, this is incredible. I'm so excited. You know, anybody who is listening to the podcast, please follow Nichole's journey as she, you know, does this thing. It will air on PBS.
Yep.
The trailer comes out in December,
Yep.
and then the show itself comes out in 26. Is that correct?
Yeah, in spring, yeah.
In the spring. So anybody who's interested in following the journey, Nichole, we're pretty much at the end of our time. I could sit here and talk to you all day. I adore you. I am so incredibly, you know, proud to know you, and you know, as a woman who is formerly incarcerated, has been impacted by chronic drug and alcohol use and active chronic homelessness. Like, I know the work that you're doing in the street every day. Mm-hmm. It's like one of the, you know, in all of the things that you do, it's one of the things that I think, you know, it's like, although you are a woman who has been on an educational journey, who is a parent, who has, you know, had multiple, you know, attempts at like recovery and reentry and all of those things, is that each part of your story is not exclusive to you, and you have taken like the healing that has happened in your own life and used it to like make a difference in the world for the like most marginalized, the most forgotten, you know, all of that. And so like my hat's off to you completely for the work that you're doing in the world. And I will continue to like follow you and your journey, and really more than anything, I just want to say you, like, on behalf of, you know, the women who are incarcerated and, you know, are at the beginning of their journey, or those who are still actively kind of lost in addiction and chronic homelessness. Like, I just want to say thank you for continuing to do the work that you do and make the contribution that you do. Yeah. And so thank you so much for joining us today.
Thank you.
And we'd also like to thank, of course, King County Behavioral Health and Recovery Division for allowing this podcast to be possible, so that we can share incredible stories like Nichole's and bring, you know, awareness into the larger community about, you know, what's happening in the recovery space and the world at large. And then, of course, we thank the team at Orbit Studios for making this podcast possible. Thank you so much, Nichole.
Thank you.
Yeah.
Yeah. Thank you.
Thank you. So good. Oh,